Let's take a moment to review the hypothalamic pituitary adrenal axis. The hypothalamus secretes corticotropin-releasing hormone. This hormone then acts at the level of the anterior pituitary gland to initiate secretion of adrenocorticotropic hormone, or ACTH. ACTH will then travel via the bloodstream and interact with the adrenal cortex to induce the secretion of cortisol. Cortisol has a negative feedback effect at both the level of the hypothalamus and the anterior pituitary. Approximately 85% of patients living with Cushing's disease have what is known as the ACTH-dependent form. This is also called pituitary-dependent Cushing's disease. Most patients have micro or macroadenomas in their pituitary gland. Rarely, these lesions can be cancerous, so both micro and macroadenocarcinoma are also possible differentials. Approximately 15% of patients with Cushing's disease have the ACTH-independent form of the disease. This is also often called primary adrenocortical tumor. Of course, you and I can induce an iatrogenic form of the disease through prescription of corticosteroids. When a patient either receives very high doses of this class of medication or they receive these types of drugs for prolonged periods of time, we can induce a state of Cushing's disease. There are other rare forms of the disease. For example, tumors in the lung that secrete inappropriate levels of ACTH have been documented. So let's make sure we're all very comfortable with the hormonal actions for patients with ACTH-dependent Cushing's disease. Again, the hypothalamus secretes corticotropin-releasing hormone, but the pituitary gland is autonomously secreting too much ACTH. That ACTH travels to both adrenal cortices to stimulate the production of cortisol. Most patients with the ACTH-dependent form of the disease have adenomas arising from the pars distalis of the pituitary gland. Very few of these growths are actually malignant. For this reason, one of my asks of practicing veterinarians is to try and avoid the term brain tumor when you're talking to families about their dog with ACTH-dependent Cushing's disease. As you can imagine, a lot of pet parents panic. Very negative thoughts go through their mind when they hear the term brain tumor. You and I technically know that these are tumors in the anterior pituitary gland. They're typically benign tumors in the form of microadenomas, so they're less than 1 centimeter in diameter, and approximately 50% of those are less than 3 millimeters in diameter. Unfortunately, when the average pet parent hears the term brain tumor, they freak out. They immediately go to negative places, and I've even had some parents jump to a decision to euthanize their pet living with Cushing's disease, simply because they heard the term brain tumor used to describe their dog's Cushing's disease. I'm not advocating for not telling parents that there's a problem in the pituitary gland. My ask is that we simply use different terminology to help them understand this disease, because with treatment, as I'm sure you know, the vast majority of patients with ACTH-dependent Cushing's disease respond very well.